From ABC News headquarters, this is...
Chad? Thank you. And up next, a brief word from Health Watch, but first, a word from our sponsor, Anusol.
Hemorrhoids. Millions of men and women suffer from this silent killer.
So ashamed.
Topical creams just don't work.
Don't look at me!
Hemorrhoids do not have feelings like you and me.
Ow!
They make life unlivable.
You've ruined Christmas!
But what are you going to do about it?
Anusol suppositories. Use as directed.
Our sponsor, Anusol Cream. Now, back to Health Watch, and we have a news briefing with Cordell Furlington on hemorrhoids.
Alright, thanks Sam Cockle and Chad Sexington. Now, we're at Harmony Assisted Living with Gertrude and Huxley Fitzgerald. So, how are you today? Well,
Good.
I'm in a little bit of pain right now.
So how old are you both?
I'm 79.
I'm 84.
So, how many years, did you have hemorrhoids?
84 years.
I've had it for about 62.
So, Gertrude and Huxley, what are the symptoms that you have?
Well, I have a lot of extra internal bleeding, and also I have trouble standing up for long periods of time.
How about you, Huxley?
Every time I poop, I have to poop again. And there's a lot of itching, scraping, just all around pain every time I poop. My poop is painful.
Well, Gertrude and Huxley, thanks for coming out and telling me about that story. And we'll send it back to the Channel 12 news station. I'm Cordell Furlington. Signing out.
Thank you, Cordell, for that very interesting story about hemorrhoids. Now, after the commercial, we will have Dr. Piles, a proctologist, in to talk about hemorrhoids and his experiences.
Oh hi, I'm Dr. Harry Johnson. Ever since I was a young boy, I suffered from a serious medical condition known as chronic anal edge. I tried everything, prescriptions, over the counter, even the home remedies, mayonnaise, bacon grease. It just didn't work. Then I found Preparation H. Preparation H contains a maximum strength doctor-prescribed ingredient, and its cooling effect helps to calm down even my strongest itch.
Preparation H relieves burning, itching, and of course, all your worst rashes.
Preparation H gets my vote. Side effects may include itching, anal bleeding, or anal seepage. If any of these symptoms occur, please contact your doctor.
Alright, and we're back with Channel 12. I'm Cordell Furlington.
I'm Chad Sexington.
And I am Sam Cockle. And I'd like to introduce you to our guest speaker today, Dr. Piles.
Thank you very much, and thank you for having me on the show. Hemorrhoids is one of my favorite topics to talk about.
So, Dr. Piles, what are hemorrhoids?
Hemorrhoids are swollen and inflamed veins in your anus and rectum. They may result from straining during a bowel movement or the increased pressure on these veins during pregnancy. Hemorrhoids are very common, and as you grow older, your chances of obtaining hemorrhoids increases. By age 50, about half of adults have had to deal with the itching, bleeding, and pain that often is a signal of the presence of hemorrhoids. Fortunately, though, effective medications and procedures are readily available to treat hemorrhoids, and in many cases, hemorrhoids may require only self-care and lifestyle changes.
Wow.
So, what are the different degrees of hemorrhoids?
Well, there are 4 different degrees of hemorrhoids. The first degree hemorrhoid does not protrude from the anus. The second degree hemorrhoid protrudes from the anus during a bowel movement, but returns to the anal canal afterwards. The third degree hemorrhoid protrudes from the anus during a bowel movement, but you can push it back inside with your finger. The fourth degree hemorrhoid is always outside the anus and cannot be pushed into the anal canal.
So, Dr. Piles, what are the signs besides the obvious that you might have hemorrhoids?
Very good question. Hemorrhoid symptoms usually depend on the location. An internal hemorrhoid you can't see or feel, but straining or irritation from passing stool can injure a hemorrhoid's delicate surface and cause it to bleed. When this occurs, you may notice a small amount of blood in your toilet or toilet tissue. Since internal anal membranes lack sensitive nerve fibers, These types of hemorrhoids usually don't cause discomfort. Occasionally, straining can push an internal hemorrhoid through the anal opening. When this occurs, it's called a prolapsed hemorrhoid. And to give a little example, I brought my friend Budalupicus, and here we have his crack and 2 prolapsed hemorrhoids hanging out.
Very interesting, Dr. Bob.
An external hemorrhoid tends to be more painful. Sometimes blood may pool in an external hemorrhoid and form a clot, also known as a thrombus. This will cause severe pain, swelling, and inflammation. When irritated, external hemorrhoids can itch and even bleed.
So, Dr. Pals, what are some of the causes of hemorrhoids?
Well, there are many causes of hemorrhoids, but in general, hemorrhoids develop from an increase in pressure in the veins in the lower rectum. Common sources of pressure would include constipation and the accompanying strain from constipation, diarrhea and the continuous expulsion of loose stools, sitting or standing for a long time, especially on the toilet, obesity, pregnancy and childbirth, heredity, and aging.
But, when should I consider seeking medical help?
Well, as a general rule, you should see your doctor if your hemorrhoids don't improve with self-care, cause pain, or bleed frequently or excessively. A common sign of internal hemorrhoids is rectal bleeding. But rectal bleeding can occur for other reasons, so see your doctor to rule out more serious conditions or diseases. Other causes of bleeding in the lower gastrointestinal tract include colorectal or anal cancer. If the onset of your hemorrhoids occurs along with a marked change in bowel habits, or if you're passing black, tarry, or maroon stools, consult your doctor without delay. These types of stools can signal more extensive bleeding elsewhere in your digestive tract. Seek emergency care if you notice large amounts of rectal bleeding, lightheadedness, dizziness, or faintness.
Here's a crazy question. How would a doctor screen me to see if I had hemorrhoids?
Well, a doctor may determine if you have external hemorrhoids simply by looking. For internal hemorrhoids, your doctor may want to conduct an examination with a rubber-gloved finger. But even this technique may be inconclusive because internal hemorrhoids are often too soft to detect by a rectal examination. In this case, your doctor may want to examine the lower portion of your colon and rectum with an anoscope, proctoscope, or sigmoidoscope. A more extensive examination could include an examination of the entire colon and rectum using a flexible fiber optic colonoscope. This will help exclude bleeding lesions not only in the rectum but also in the entire colon. Close follow-up is necessary, however, and continued bleeding despite hemorrhoid treatment requires additional examinations.
So, Dr. Pals, how would I go about receiving treatment for a hemorrhoid?
Well, in many cases, hemorrhoid treatment involves steps that you can take on your own, but sometimes medication or surgical procedures are necessary. Some medications are only needed if protruding or mild discomfort occurs. Your doctor may suggest over-the-counter creams, ointments, pads containing witch hazel, or a topical anti-inflammatory agent containing hydrocortisone. The local treatment in combination with daily warm baths may relieve your symptoms. But if you're in a more severe case of hemorrhoids, you would use probably surgical procedures, which kind of include if a blood clot has formed within an external hemorrhoid, and your doctor can easily remove the clot with a simple incision. So what you may have to, there's many different types of treatments. One is a rubber band ligation, a sclerotherapy, infrared light, surgery, and stapling.
Sounds like a lot of the symptoms that Chad has.
It's kind of mean.